And we are live. Hey, Dr. C, how we doing today?
I'm doing all right. How are you doing?
Doing good. Welcome, everybody. I am Daniel Trivy, along Dr. Cherikopali, or Dr. C, as she's commonly known. We are the owners and founders of Regenerative Sports Spine and Spa. We're here in the Central Florida, Greater Orlando area. And we come to you every Monday to kind of drop some knowledge on natural ways of healing via regenerative medicine, stem cell therapy, for bone, muscle, joint, and spine, but then also for cosmetics. So there's a lot of stuff people out there doing, surgeries and Botox and fillers and all those things. But there are some natural ways that we can kind of turn the clock back on our skin, on our hair, and then on our nether regions, right?
Yes.
So we're going to talk a little bit today about some of those cosmetic procedures that we do that are a little more, or that are not a little more, but they're all natural, that can help give you that younger, vibrant, more excited, turn the clock back, youthful kind of feeling. So let's jump in. Where do you want to start, Doc?
I guess we could start with Botox, right? It's like that's a pretty common thing. Most of, at least the female population, a lot of males too actually do Botox for turning back the clock, as you say. Brotox, like we call it. Yeah. So, I mean, that's one of the things that most people do. The hard part with that is, you have to do that every 3 to 4 months and then it wears off. And then, it's like, as time goes on, it kind of stays as something that you have to keep doing. So what we're trying to do is figure out something that you don't have to keep doing like every 3 to 4 months, right? So it's like something that's going to help your skin look healthier, reduce the lines, the fine lines and wrinkles, sunspots, all those kind of things, which Botox doesn't do for the long term. So that's one of the ways. And like you said, dermal fillers is another way. That's typically to fill the areas that are losing, fat and volume as we get older. It's like some of the areas are like right here near, it's called your nasal labials. It's like there, you can do it in the cheeks. And actually, interestingly, there's a lot of people that are doing it in the chin now. It's if you have it's like a chin that's not as prominent, and then that kind of makes you kind of look like you have a double chin. Sometimes you can put some in the chin, which is a very interesting new thing.
That Tom Brady butt chin look. I got you. Okay.
Yeah, there you go. So do you need that, Daniel?
I don't need any of that. Got the jawline as it is.
But actually, it's like you can do fillers a lot of other areas too. I mean, you can do it under the eyes. You can do them in the nose. Like if you have a little bump in your nose that you don't like, we can smooth that out. There's a lot of different areas that you can use that as well. But that's getting away from the plasma that we're that we're talking about. So
Right.
those are a lot of the common things that we do that are temporary. So what we're trying to do is switch into things that will help more longer term. And so the platelet-rich plasma is one of those that can actually help regenerate, not regenerate, but it's like help with collagen induction is what we call it.
Got it. Okay, so and let's do really quick for those of you who are just joining us what PRP actually is. So PRP comes from your blood, and it is essentially the liquid or plasma portion of your blood. Your blood has red blood cells in it and white blood cells in it. And the red blood cells, ta-da, make your blood red, while the white blood cells are there to kind of clean and signal healing, that kind of thing. So what we do is we draw your own blood off and then we spin it down really quickly. So we separate the red blood cells from the actual plasma, which contains some white blood cells as well as some other natural healing factors that the body uses when you have a cut or an injury. And then once we have that from your own body, we can then use it as it pertains to the skin and the face.
So we can inject it, it's like in different areas that you may be losing volume and collagen. But I find that people don't really see the results as much with that because it's one of those things that takes time. And then a lot of times, we don't want to give it enough time. And it's more of a preventative type of thing. So what I've seen work really well has been the microneedling, which is basically you're doing micro damage to the skin. So you stimulate blood healing and then more collagen induction is what it's called. Then we put the plasma on top of that, which then soaks into the skin better and then more diffusely, and then typically works a lot better in, getting your skin looking nice, youthful, healthy, getting some of the sunspots and then the fine lines and wrinkles better as well. And so that's really one of the better ways to use the plasma. It's not really just straight up injections.
Right. And now when we do that type of procedure, what are we looking at downtime wise? Or is there any downtime? What can people expect if they do the vampire facial?
Yeah, so for people with skin color like myself, I really am red for, not even red, I'm pink for a few hours, and that's about it. So if you're more like yourself, Daniel, it's like you'll probably be red for a day or so, and then pink for another day or so, and then it's gone. So we do give you some, serums and things like that afterwards that help with that process as well. And then the plasma itself is a healing property. So really, you're not very red for very long at all, and it really just moves the process quite a bit along. Before the plasma, you would have probably been red for about 4 or 5 days. Now it's only maybe a couple. Yeah.
Got it. And then what's the the quantity of procedures? I don't know why that was so hard for me to figure out what I wanted to say. What's the quantity of procedures that you need to have done? Is this a one and done? Is this a quarterly? Do we do 2 or 3? Or is it dependent on the person's skins and needs?
It depends on the person's skin and needs. So we would do a consult first, but typically the first time you do this, assuming that you've had skin issues for a while, you're going to have to do this probably 2 or 3 times, about 4 to 6 weeks apart. And then after that, a lot of people do it either yearly or every other year. It just depends on what you need.
Right.
I do it every probably about 6 months, just because my skin tends to be a little bit looser, softer. And so I want to make sure that I maintain the, it's like my skin health the right way for the long term. So it's like I do it every 6 months, but most of our folks do 2 to 3 times the first time, and then maybe once a year or once every other year after that. So it's something that does help maintain your skin in a good way.
Good. So. Nice. And without all the dangerous chemicals that potentially go into having better skin. So right. That's always a plus. Now, PRP can also be used in other areas of rejuvenation, like our hair, right? We hear this, a lot of times, especially in men. Women have issues with hair loss as well, but you can use PRP in the same fashion to help rejuvenate hair, correct?
Correct. It depends on what level you are, right? So if you've been losing hair and have lost hair and you have a bald spot for men here and then really receding heavily there, it's like it may be not the right choice. But again, we have consults to make sure that that's the right thing. If you're starting to notice the thinning and then just, a little bit more sparseness and just a little bit of thinning here, a little bit of receding here, then absolutely we can definitely do the platelet plasma, the PRP there to get those follicles that are dying off to try and regenerate and then work well again. So that's one of the things. But you do have to catch it relatively on the earlier side. 2 to 3 years in of thinning is fine. But if it's 10 years later, we may have to think of other options. So
right. Yeah. Mm-hmm. Yeah. What if I wanted to grow this big, thick, like mountain man beard? Because doing the PRP and the facial or the micro needling and all that, will that help regenerate like facial hair or produce more growth of facial hair, or is that more genetic?
Well, for men, it might actually help. If you have those little spots that you never really grow hair, it's like it can't, it's like regrow it where it's never grown before. But yeah, if you're starting to thin in these areas, and for men, it can definitely do that. For women, it doesn't do that. It doesn't, make you grow more facial hair than you want. It's like, because that would kind of defeat the purpose, I think.
Absolutely. So, all right. Well, if you're just joining us, we talked about natural ways of making your skin look and feel rejuvenated, restoring your youthfulness by using PRP, which comes from your blood on your face, along with some microneedling, as well as using it for hair restoration on your noggin if you are having issues with thinning or balding, as long as we catch it earlier enough. And then there's a third quote unquote cosmetic use for PRP, which we're going to dive deeper into this next week, but let's just touch on it so people understand a little bit what that's about. But you can use PRP for sexual dysfunction, right?
Correct. Yes, you can use it for sexual dysfunction, both men and women. So that's the fun part. You can actually, if you're starting to feel deterioration in those areas, you can definitely rejuvenate those areas very nicely with the PRP. So yeah.
Awesome. And what are those procedures? That's for men and for women, right? A lot of times we think sexual dysfunction, it's men, it's erectile dysfunction, but that's not always the case, right? There are issues in the female body that could benefit from PRP and the cosmetic use of it, right? And sexual dysfunction there.
Absolutely. It's like that area, the vaginal area also deteriorates, the skin and tissue, just like your face, probably most similar to your face, actually. And then, so that area can deteriorate and then become loose and saggy also, which is, not so fun to say. But yes, we can actually do things to help rejuvenate that area, tighten up the skin, and, do things to make it healthier. Similar to other areas that we use it for. So absolutely. So we can definitely make a big difference. For those of you who are embarrassed to say anything, is like it is a very common thing, especially actually women, I think, have more dysfunction than men, even though we hear more about the men typically. The studies have shown that maybe 35 to 40% of women, and then the men are more like 20 to 30%. So the women actually have, and then there's different types, of course. So it's not always just one thing. So there's a lot of different ways that we can treat you. And, it's like really depends on what's going on with you.
Absolutely. If you're just joining us for the live, we're talking about turning the clock using natural healing sources for your own body. So we talked about skin rejuvenation, we talked about hair rejuvenation, and then dealing with sexual dysfunction using PRP as well. And next week is, what did you say, Sexual Healing Week, Marvin Gaye Week? What did you say it was called?
I sure.
Sex Awareness Week or something other. So next week, we're actually going to go deeper into using PRP as well as some other unique treatments to help with sexual dysfunction in both men and women. So make sure that if you're watching this post live, you come back and check this out next week, because we're going to dive into that that portion of it. So anything else in the world of PRP and cosmetics?
No, really. I mean, just that it's multi-use, and if you're having issues of these types, come in and see us, and we'll get you on the right track with the proper treatment. Yeah, and actually, it's like some of the new. I do have one thing. So when you do these procedures, there's actually some follow-up care that is important, right? So a lot of the new all-natural skincare lines that are coming out that are medical grade actually have growth factors in them, which is mainly what PRP is. So once you do these treatments, it's like make sure to ask about the skin care that goes along with it, because if you're doing all this stuff and then following it up with chemical skincare over the counter, kind of defeats the purpose. So we really want to make sure that we get you on the proper program that's going to give your skin the best health, the most natural way, and then get you looking great for long term. So yeah.
Love it. Love it. Love it. Well, if you are just now watching this post live, drop your comments, questions in there. We will answer those as they relate to PRP and use for cosmetics of skin, hair, sexual dysfunction, or anything else that you may have heard us talk about on here that you have questions about. If you're in the greater Orlando area, we would love to be able to help you with any of these issues. We are just outside the Orlando airport. We also have some very cool, unique VIP packages that get you into town and put you up and get you transportation to and from our facility and all the things. So if that is something that you would like to take part in and take care of your body in a more natural way, we would be happy to do that for you. You can click on the links inside this Facebook page and get in contact with us, or you can also go to www.regen3.com to learn more about what it is we do. And other than that, we'll be back next week again talking about the use of PRP in sexual dysfunction for men and women. Hope everybody is doing great this week, staying safe, staying healthy, and we will be back next week.
All right. Thanks, Daniel.
Yep. See you guys then.